Mr. Mooney for 5 minutes.
Thank you, Mr. Speaker. Every morning, countless West Virginians wake up fearing that they lost a loved one to drugs the night before. And every morning, far too many West Virginians find this fear has come true. The prescription drug abuse epidemic in our state is a tragedy that we cannot afford to ignore. It ravages our communities, rips families apart, stunts the development of our youth, and further ruptures our state's already ailing economy. Overuse of prescription pain medication are leading causes of opioid addiction. When a patient has more narcotic pain medication than they need after a medical event, this excess medication can fall into the wrong hands. And a narcotic pain medication in the wrong hands often leads to addiction. In fact, the National Institute on Drug Abuse has found that 1 in 15 people who take non-medical prescription pain relievers will try heroin. Last year, the number of fatal overdoses from prescription painkillers increased by 16% from heroin and 28% in the United States. In West Virginia, the story is even worse. According to a recent study by the Trust for America's Health, the Mountain State has the highest rate of overdose deaths in the entire United States. This issue is above party politics. It's a plague that all Americans must come together to solve. That is why yesterday I introduced H.R. 4499, the Promoting Responsible Opioid Prescribing Act. This bipartisan bill strikes a harmful provision of Obamacare that places unnecessary pressure on doctors and hospitals to prescribe narcotic pain medicine. This concern was brought to my attention while meeting with doctors and other healthcare professional workers in Charleston, West Virginia, who are active in our state's medical society. In other words, this was their idea. I thank them for bringing this to my attention, and I encourage others to bring any ideas to help fight back against the opium epidemic to your local congressman. In 2006, the Centers for Medicare and Medicaid Services, CMS, and the Department of Health and Human Services developed a survey called the Hospital Consumer Survey of Healthcare Providers and Systems, pronounced HCAHPS for short. HCAHPS is a standardized survey used to measure patient perspectives and satisfaction on the care they receive in hospital settings. At first, hospitals used this survey on an optional basis. However, when Obamacare became law in 2010, it put in place, quote, pay for performance provisions that use these survey results as a factor in calculating Medicare reimbursement rates for physicians and hospitals on quality measures. This provision of Obamacare was intended to save money and to force improvements on hospital performance. However, it has led to unintended consequences in the area of pain management. The HCAHPS survey contains 3 questions on pain management. 1, during this hospital stay, did you need medicine for pain? 2, during this hospital stay, how often was your pain well controlled? 3, during this hospital stay, how often did the hospital staff do everything they could to help you with your pain? Because of the tie to reimbursements, hospitals and physicians are pressured to perform well under the HCAHPS, including the pain management questions. However, doctors, not the federal government, know how best to treat patients, and that includes the question of how best to use narcotic pain medication. The PROP Act would remove these pain management questions from consideration when CMS is conducting reimbursement analysis. However, the patient would still answer the survey questions so that hospitals can monitor patient satisfaction. By severing the relationship between HCAHPS questions on pain management and reimbursement, doctors would no longer feel the undue pressure to overprescribe opioid narcotics to people they believe may be abusing it. This simple change will help reduce access to narcotic pain medication for patients who do not need it, thereby reducing the risk of addiction. The bipartisan co-sponsors of this bill, Annie Custer, Chairman Hal Rogers, Stephen Lynch, Frank Ginta, Tim Ryan, and Barbara Comstock. Our bill has been endorsed by the American Medical Association and the American Society of Addiction Medicine. I encourage my colleagues in the House to consider co-sponsoring my bill 4499, the PROP Act. Thank you, Mr. Speaker, and I yield.